My name is Dr. Arun. I'm an oncologist by profession. Well, I was perfectly alright for 2 years ago. Like in 2022, once while I was going on a trip, I suddenly felt a pain in my both hip joints. I thought it might be some muscular strain or something, or some stress or strain something. So I ignored it and took some mild analgesics and continued with my trip. Well, after I returned back, it was okay. I thought it might be still there for some time. I continued taking the medications, but it persisted for a long duration of nearly 3 months. At one point of time, I started fearing what has happened to my hip joint. So, as being a doctor myself, I just got an X-ray done and I consulted Dr. Shrikant Rao. Dr. Shrikant Rao is my MBBS batchmate, so I know about Dr. Shrikant's skills and expertise, so I was confident about him, about diagnosing and treating my problem. So when I consulted him, just seeing the X-ray, he told I have developed a bilateral hip joint avascular necrosis. So he asked me to get a confirmatory imaging through MRI, and MRI was confirmatory about it, and he suggested total hip replacement surgery is the best line of management for the current stage of my disease, so I should, without thinking, go for it. Many people told go for some senior expert person, don't go to some young person. It is in this such major surgeries, it's better to consult a senior person. But I was confident about my friend Dr. Shrikant and I believed in him, so I directly went ahead with him, irrespective of what other people told. The left hip replacement surgery was done in July 2022 and the right hip replacement surgery was postponed. He told, let us keep it as a decompression surgery. Once a necessity falls to go ahead with the hip replacement surgery for the right side also, we can go ahead with it. I agreed with him and I was perfectly normal after the hip replacement surgery on the left side. For 8 months I was fine. After 8 months I started again developing pain on my right hip joint. A repeat imaging was done and I consulted Dr. Shrikant and he told the decompression surgery has failed. Well, that was expected at some point of time, it is going to happen. So he advised me to undergo a total hip replacement surgery for the right side also. Well, I had a good experience of the total hip replacement surgery done on the left side. So without second thought, I went ahead with it. In 2023 May, I underwent a right total hip replacement surgery. After that, I was on post-operative recovery for around 1 month. I was on leave from my work. Well, because I was working from different place, I was on leave. The post-op recovery was the best with Dr. Shrikant Rao. Within 24 hours, I was able to walk with the walker. And within 7 days, I was able to walk without the walker. This was surprising for me because most of the people whom I have seen who have underwent or heard who have underwent hip replacement surgeries, they would take nearly 2 weeks, 3 weeks to walk without the walker. But this was a best experience which I had, the post-op recovery which I had. So I joined back to my duty and Dr. Shrikant Rao advised to keep minimal physiotherapy because for hip joint he advised walking is the best exercise, not to do unnecessary stretching. I strictly followed his advice and within 3 months now I am able to do all my routine activities without any dependence. Yes, there will be a minimal limitations which is acceptable. Now I am perfectly alright and I am able to do all the activities. And he has advised me to take certain precautions to increase the lifespan of my hip joint to prevent unnecessary stretching and straining. So I am following that. That restrictions has not caused any limitations for my daily activities. I am going back to work. I am perfectly okay. I even recently went to a hill station trekking. Thanks to Dr. Shrikant Rao for this wonderful experience to my pre-op and post-op recovery. Thank you.